Cryolipolysis is a technique to destroy fat cells with the application of cold. We use it especially to destroy small deposits of fat. Now, how does it work? In order to understand how it works, we have to understand how the fat cell works. For this reason, I like to compare fat cells to plastic bags. Let's suppose you go to the supermarket to buy plastic bags for your garbage. You go to the area where the plastic bags are, you take a roll with 20, 25 plastic bags, you put it in your purse and you go home. Now, when the plastic bags are empty, the volume is very small. So let's say you have 10 plastic bags that are very small and you fill them with water. And instead of having 10 small plastic bags, now you have 10 big plastic bags, but you only have 10. This is exactly how the fat cell works. The fat cell can be filled with fatty acids or can be empty of fatty acids. How to fill it or to empty is with exercise, diet, etc. But we arrive to some point where despite exercise or despite having a good diet, the fatty acids the cells contain a minimum amount of fatty acids. And in some people they are in good weight according to their size. There is an excess of cells, not an excess of fatty acids. And when we have an excess of cells, the only and unique way to treat is removing the cells. And we can remove the cells with cryolipolysis or with a liposuction. Now, when an overweight person has deposits of fat, this overweight person has an excess of fatty acids inside the cells. So the cells are full. The treatment is to lose weight. But when the person is in normal weight, he cannot lose weight. If we have to destroy the cells because there is an excess number of cells. Now, cryolipolysis consists in applying a handpiece on top of the skin, and this handpiece is going to freeze the fat during 1 hour, and 30% of the cells that are being frozen for 1 hour will be destroyed during the process of warming up. As a result, the excess of fat decreases and the skin retracts. The beauty of this system, or the beauty of this technique, is that it's completely non-invasive. It means that you can come in your lunchtime, have the procedure done, and you can go back to your office. There is no anesthesia, it's not painful, and the follow-up or the post-procedure is extremely easy. We use this technique in areas where we can find fat deposits, like in the back, in the posterior part of the back, in the tummy, sometimes in the lateral aspect of the thighs, in the inner aspect of the thighs. And what we promise our patients is to reach 30% of decrease in the amount of fat. How do we measure that 30%? In the areas where we can do, we make something that is called a pinch test. So we pinch the distance between the two sides of the skin here, and we measure the distance, let's say 10 centimeters. Then we expect to have 3 centimeters reduction after 1 session of cryolipolysis. Just as easy like that, and in most of the cases it works. In some cases it doesn't work, then we can repeat a session, or we pass into a little bit more invasive technique like liposuction.